Hello everyone, I am Mahmooda Begum from School of Sciences, Maulana Azad National Urdu University. My presentation today focuses on the temporal changes in soluble HLA-G and its inverse relation with the systemic inflammatory index SII in women with a history of recurrent pregnancy loss presented at the 9th BGCI International Conference. Reproductive failure is a threat to species survival and could occur due to pregnancy-related complications. Recurrent pregnancy loss, a pregnancy-related complication, is defined as the loss of 2 or more consecutive pregnancies before the 20th week of gestation and has a global prevalence of 1 to 5%, with 50% of the cases due to unknown causes. Pregnancy involves the mother's immunological adaptations to the semi-allogenic fetus, and HLA-G marks the beginning of this process, as it is the first molecule expressed on extravillous trophoblast cells at the maternal-fetal interface, and its expression remains throughout the entire pregnancy. HLA-G, a non-classical class 1 MHC molecule, is expressed as both a cell surface glycoprotein and soluble isoform, interacts with various immune cells, and is a key immunomodulator. It promotes immune tolerance, prevents fetal rejection, and promotes fetal growth. The systemic inflammatory index is a non-invasive composite biomarker calculated from 3 peripheral blood parameters: neutrophil, platelet, and lymphocyte counts. It is found to be a prognostic indicator of various inflammatory conditions. Our study aimed to investigate the intergestational variation of soluble HLA-G and its relation with systemic inflammatory index in pregnant women with a history of RPL. Blood samples were collected from 150 South Indian women with a history of RPL, followed by quantification of soluble HLA-G from the serum using ELISA. Cell count data for neutrophils, lymphocytes, and platelets were used to calculate the systemic inflammatory index. The results indicated a temporal pattern or shift of both soluble HLA-G and SII in the 3 gestational phases of the pregnancy. However, the patterns were opposite to each other and showed an inverse relationship. Soluble HLA-G concentrations were low in the first and the third trimesters and comparatively high in the second trimester. An exact reverse pattern was observed for SII, where the mean SII values were found to be high in the first and the third trimesters and very low in the second trimester, which showed a perfect sync with the pro-inflammatory phase of the first and the third trimester and an anti-inflammatory phase of the second trimester. Given the lack of control data to compare patient data, our study establishes a vision for a longitudinal case control study for an in-depth analysis of immunological shift, considering the use of soluble HLA-G and SII as dual non-invasive markers for the study of RPL and other reproductive disorders.